Good day, everyone. My name is Lisa Marie Kilgore, and today I will be discussing with you product evaluation and purchasing, a review for clinicians. I have no conflict of interests. Today's objectives. So today we're going to discuss the best approach for product selection based on evidence-based data, explore resources that can assist clinicians in effective product evaluation and purchasing, and identifying the best study designs to evaluate a product's clinical effectiveness. Is it important to trial a product before use? Sometimes, maybe, yes, no. In all actuality, you should always trial a product before you use it on any type of patient. How is the CDC involved in product selection and review? Well, the CDC is a non-regulatory influencer. What I mean by that is the CDC is a non-regulatory influencer that has the ability to drive regulations that often become standards of practice that are used by governmental and accreditation agencies. The CDC takes part in several work groups. By that, I mean they are a part of work groups such as HCPAC, as well as several others. But the main goal is to improve the patient outcomes and ensure that products and devices are safe for use. Are products endorsed by the CDC? That's a really big question. So according to the CDC, they work in conjunction with the FDA. And the types of products or brands that they typically review are sometimes there is only one manufacturer of a product or similar products that may come to the market. CDC may endorse types of products, but not a brand. They're not allowed to actually endorse a particular brand by a manufacturer. In the previous slide, I discussed with you the different types of work groups that the CDC works with and endorses. HCPAC happens to be one of those. HCPAC stands for Healthcare Infection Control Practices Advisory Committee. The HCPAC is a federal advisory committee that focuses on the practice of infection control strategies. In 2017, HCPAC was asked by the CDC to develop a process, and this process is used for formulating product-specific recommendations. By doing this, it eliminates bias. HCPAC was published basically in July of 2019. The work group has also developed an infection prevention product assessment algorithm. This algorithm is a wonderful tool for IPs to use, infection preventionists. This tool helps you in going through a complete and total checklist that helps you to understand how to look at a product, how to review a product, and to assist you in the types of trials that you should use. Another work group that the CDC is involved in is called Medical Product Safety, or MPS as an acronym. MPS is the CDC and the FDA developed courses that are hosted through Healthy People. Healthy People is on the Office of Disease Prevention and Health Promotion website. Within the Medical Product Safety, or MPH, they have created this to ensure that medications, devices, and other products are used safely on patients. This is a list of the CDC resources that I discussed with you. For HCPAC, this is the process for assessing products for infection prevention in healthcare settings, a framework from HCPAC. So if you go to this website from cdc.gov, you'll be able to look at the algorithm. It's extremely helpful for you. The Healthcare Infection Control Practices Advisory Committee, HCPAC. This is a process for assessing products for infection prevention in healthcare setting, a framework from HCPAC. So if you can see this HCPAC infection prevention product review worksheet, this is the worksheet that you should use in order to look at a particular product to see if the product or device is FDA approved, cleared, or EPA registered. You would start with this very first section here and work your way down. Please pay close attention to all of the questions that they're asking you within this 2-page document. For the particular purposes of this analysis, is the product or device being considered for use in accordance with the FDA or EPA approved labels? I mentioned that several times before in those particular labels. One of the other things that I mentioned to you was to pay close attention to your patient population, because your patient population or your demographics will help you to fill out this HICPAC infection prevention product review worksheet. So go down, check out the key questions, and it tells you what to include. You just need to fill out the dates, the time frames for the data source, and put any comments in these sections that you go back to. And this will help you explain the reason why you're wanting to look at that particular product to your senior leadership. It will also help you with your value analysis when you take this individual product or disinfectants or whatever the product is or device that you would like to use in your facility to supply chain. It is a 2-page report here. It gives you a legend, and then it gives you just a little bit of more information about the HICPAC. In the next slide that I would like to talk to you about in the link is the Healthy People Medical Product Safety, or MPS. When you click on the link for that, it takes you right to Chapter 27 of Healthy People 2020. There is also a Healthy People 2030 that's going to be coming down. It should be out already. But when you look at the Medical Product Safety, or MPS, it tells you that the lead agency is the FDA, and it explains all the goals, the status of the objectives, and it takes you through everything and medical product safety objectives. This is really valuable and really good information for you to review and take a look at. Evidence that you should ask for. So there's several types of evidence that you should ask for prior to looking at any type of product or device. Is it FDA cleared? Does it have the highest level of evidence or safe studies? Does it follow national guideline recommendations? It's up to you to decide what fits best in your hospital's protocol. The big points to consider is whenever new practices or products are considered, there are some specific criteria you need to consider. This is a list of U.S. Food and Drug Administration, or FDA is what we call them, about FDA, and it will take you directly into the FDA's website about the FDA, and then you can click and take a look and see all of the information on here that I've gone through in dealing with the FDA. The FDA also provides accurate science-based health information to the public. I have provided for you also a list of laws that the FDA enforces. This all came about in 1906, if you can believe that. That was when there were over 200 laws that were first enacted. In 1938, the FDA decided that they were going to pass a law after illegally marketed toxic elixirs killed over 107 people. This is including children. In 1962, Kavaver-Harris Amendment occurred, and this was due to a specific type of drug. Pardon me. This was due to a specific type of drug and huge tragedy that occurred in Europe. The FDA prevented the product from being used in the United States. That's one of the biggest things that they do, is they monitor and see the things that are occurring in other countries. And if they do occur in other countries, they enforce these particular laws by not allowing them in the United States. And in 1976, the Medical Device Amendment related to faulty devices that caused more than 10,000 injuries including over 731 deaths. So if you go into these little areas here that I provided for you, you can look at every single one of these laws and see how all of these things were enacted prior to. The laws that I discussed with you, if you click on laws enforced by the FDA, it literally will take you through every single one of the laws and why the FDA was enforced in 1906 because of the 200 laws that they created in order to protect patients. There are lots of other related resources in here and resources and recent legislation that you can look at. So what does the FDA approve? The approvals are far. There's so many of them, but if you click on this FDA link, it'll tell you exactly what the regulated FDA products are. The next link that would be really great for you to look at is what does the FDA approve? So this is the approvals of FDA regulated products. Within this link, you will see that they approve products for drugs. They want to ensure that human drugs and therapeutic biologics, proteins, and other products derived from living sources used for therapeutic purposes. That's what this particular one is for. Biological products, for medical devices, animal drugs, and food additives. But pay close attention to where it says the drugs and also medical devices. This particular section is extremely important to review and to look at. FDA approved. Not all products need an FDA approval. And also the FDA does not approve companies. They do the exact same thing as what the CDC does. They approve products, certain products, but not all are needed to be approved. Some vendors and manufacturers will state that they have FDA approval on their products. Exactly what does that mean? Well, this means that the FDA does not approve their product prior to it going to the market and being sold to any type of consumer. The FDA provides a guide for all consumers and healthcare providers on how they are required to regulate these particular products. The FDA does not approve companies, but is authorized to inspect these companies to verify that they are in compliance with applicable good manufacturing practice regulations. So they can come into your business or company at any given time. And when they do, they are able to audit and see whether or not you are abiding by all of the compliance and regulations. FDA cleared versus FDA approved. There are two separate things here. So products on the market will have an FDA clearance or cleared or an approved indicator. So according to the FDA, products and devices go through two types of applications prior to pre-market notification and pre-market approval. A device has to be cleared prior to existence. So this device will compete against others in the marketplace. So if they're competing against others in the marketplace, that means that they're cleared and this is a device that is already in existence. If it is an approved device, this is a device that are new to the market and there are no other devices that are similar or alike that particular product. Now, is it important to understand exactly what the intended use for the product is? Absolutely. That is considered as an indicator. So both of these are required in order to keep patients safe and free from harm. That is why all products and devices are required to have an insert under indications for use to explain how to use the product safely without causing harm to anyone. I have provided here also a list of FDA resources for you. Manufacturing and user facility device experience. This is called MOD. These links here will take you to MOD, and they will explain to you exactly what that is, where you can look for particular devices, and it's a database that's within the FDA that houses medical device reports that come from the end user such as a hospital, a clinic, a manufacturer, a patient, or a consumer. And what this does is you can actually go into this mod and see any type of devices that have experienced any issues. There are many other databases for device reporting, such as MedSun reports, recalls, CLIA, and the Code of Federal Regulations, or CFR, Title 21. Here are additional FDA resources. When you click on the link that says Manufacturer and User Facility Device, or MOD, this particular link takes you right to the FDA's facility device experience. You go into this particular database. If you look over here to your right, you can see all of the different other databases that you can look in to check to see whether or not the FDA has received any other reports that are on medical devices that are used on patients, or medical devices that have been suspected of causing death or serious injuries to patients. So the FDA uses these MDRs to monitor device performance. So any consumer, any manufacturer that discovers that their product has caused harm, serious or other, to a patient should be filling this out. In the search database, you fill out the product problem, you put the product class, the event type, the model number, and the brand. When you fill all of this out, you submit this to the FDA that goes into the mod. This is something that is extremely helpful for all, whether it's the patient or for the consumer or for hospital facilities. The FDA also provides an FDA 101, and that's an overview of the FDA's regulatory review and research activities. When you go into this link and click on it, it explains, it's kind of like taking a basic FDA 101 course. It's really valuable information that you should take a look at of the FDA's regulatory review and research activities. This is another really valuable tool. It offers a broad overview of the FDA's regulatory review and research activities, as well as its products and quality safety responsibilities. When you go down into these areas here, they provide courses to you that could be extremely valuable. And then also I spoke of the Code of Federal Regulations. I provided the link here for you as well. In this particular link, if you click on the eCFR, Title 21 of the CFR, Food and Drugs, this will take you to the Code of Federal Regulations. This has every single chapter in here about particular products or devices. The next link is the FDA guide. Is it really FDA approved? So you can search in this particular link to see whether or not a particular product or device actually is approved. The FDA has a broad amount of information in here, and they provide you with a lot of really good, vital data. There is also an FDA cleared versus FDA approved. So you can look at all of these guides and documents, and they'll really help you in knowing exactly how you should review and approve a particular type of product or device. I give the explanation to you as to what's the difference between the two, but they are required. And it also talks about the necessity of the FDA making sure that the patients that are using whatever particular medical devices or product, it is safe for them. Environmental Protection Agency, the EPA. Who is the Environmental Protection Agency? The EPA was created by President Richard Nixon and was approved by the House and Senate on December 4th, 1970. The EPA's overall responsibility is to protect the environment. So that means they want to protect the air and the water from pollution. You need to know that this product is registered with the EPA and what the approval type is. So products on the market will need to be EPA registered. According to the EPA, they require approval or registration in advance of any sale or distribution of any of these particular products. Just always go to the EPA and you can click on any of the links that I'm going to show you on the next slide, where you can check to see whether or not a product has actually been approved and registered prior to being distributed. So these are some of the EPA's resources. The milestones in EPA and environmental history, U.S. Environmental Protection Agency, environmental topics, and what is the process for EPA approval of disinfection products related to COVID. Now, I had to put that in there because currently right now, we live in a world of COVID. So there are still lots of questions and lots of unknowns about COVID. So you can click on this particular link and it can take you to all of the areas within the EPA that discusses COVID. So the EPA regulates pesticides, low and intermediate level disinfectants, and medical waste incinerators. You need to know and ensure that your product, if it's a germicidal detergent and disinfectant, and it is used for cleaning and disinfecting non-critical medical equipment and environmental surfaces in your health facility, they need to be EPA registered for use in hospitals, regardless of your healthcare delivery setting, whether this is inpatient or outpatient. You always need to ensure that it states on there for use in hospitals. The next link that I would like to share with you in the Environmental Protection Agency resources, milestones in the EPA and environmental history. This particular link will take you directly to the EPA, and it will discuss the history behind the EPA and how they came about. The next link is the U.S. Environmental Protection Agency. In this link, it also gives you information on EPA international priorities. Their key topics, their information that will provide you with news from the EPA to keep you updated on the types of devices that have been approved or products that have been approved. There are also environmental topics by clicking on that link. Here's the Environmental Protection Agency resources. If you click on the environmental topics, it'll open up to a link that will take you over here to a broad amount of topics, A through Z, or you can narrow your topics down to look at different things. As an example, you could go into any of these particular links and open and click that up. It will take you to databases to search for particular chemicals. You can look at specifics for disinfectants. You can also click on this disinfectants for COVID. As I had mentioned in a previous slide, to ensure that a product has been registered with the Environmental Protection Agency or EPA, they have a list in. The list in will show you whether or not a particular disinfectant has been registered with the EPA. Prior to a product being given to a consumer, you must ensure that that product is listed here within the EPA. Once you click on the EPA link, you will type in this search button, list in, and that will pop up in your search page. This is what it will look like. You will click on list in tool, and this is what will be displayed once the link launches. It will show you every registered product that is in the EPA. If you do not have an EPA registered number for that particular product, then you should not trial that in your facility. It is extremely important that you check that there is an EPA registered number for the product that you will be trialing in your facility. Additional resources, this is where you would go for clinical trials. Once you click on that particular link, it will take you to clinicaltrials.gov, and this is where you can learn about clinical trial studies. What is a clinical trial? The different types of trials that you could use within your facility. You need to understand the level of evidence. And once you understand your level of evidence, then that will help you decide what type of trial that you're going to use. The additional information, if you click on in the FDA, under regulatory, this will also discuss with you clinical trial guidance documents. You may go through each one of these in the FDA to explain to you about different types of trials that have occurred. And it also has some information where you can actually type in that trial or search for a document to look at the trials from other vendors. Additional links to click on is the NIH, where they will show the trials. If you click on any of these additional things here, what are clinical trials and why do people participate? These are just the trial basics. If you are not familiar with any types of trials, this is a good start for you. Here is an additional link from the CDC that also discusses trials and the countermeasures that I had discussed earlier. It will let you know and talk to you about MCM's medical countermeasures and are the medicines and medical supplies that can be used. So here's some additional information. Within the CDC resources, one additional link under Healthy People, Medical Product Safety, or MPS, is this particular link here. It is housed under the U.S. Department of Health and Human Services, Office of Disease Prevention and Health Promotion. This is where you will find the Healthy People 2020, as well as the Healthy People 2030. This is Medical Product Safety Work Group. As you can see, the lead federal agencies are the CDC, the Office of Disease Prevention and Health Promotion, and the National Center for Health Statistics. The members of the Product Safety, or MPS work group, developed objectives that are strong scientific support for safe use of medical products. So here's another really wonderful resource where you can come down here and look at different MPSs, and it tells you about the work group on how to decrease adverse events and harmful reactions by focusing on safety efforts. So this is really valuable information. It helps you to understand medical product safety. Products need to be reviewed for patient safety. One of the big things you need to take a look at in patient safety is what are the infection risks? What are the potential for errors? What are the compatibility of devices that you're going to use on these particular patients to keep them safe? What are special population needs? In your particular hospital or your facility, it could be different populations. You need to ensure that you're doing some type of risk assessment to know what your specific special population needs are. And there are unintended side effects or complications for these particular products or devices. You need to review all of these particular things to ensure that you're keeping your patients safe. Employee safety. Not only do you need to think about your employees, your patients, but you also need to really think about, will these particular products or devices cause injury or any types of exposures to your employees? There's also a financial impact. If you're looking at a new device for a particular product, what's the purchase price? Is there any additional equipment or materials that will be needed to be used along with this particular new product or device? What's the impact of efficacy for non-efficacy? And lastly, employee satisfaction. What's the level of difficulty or what's the impact on their workload? If it is so difficult that the employee is unable to use it, or they have to have consistent training over and over and over again because it is extremely difficult. Maybe you need to relook at this particular product or piece of equipment. What is the impact on their workload? Is it going to slow down their workflow, especially in the ED? So now that we know the process, let's take a look at the product review and what the goals should be. There could be a possibility of conflicting goals. Please remember to review these articles, these particular products and things extremely carefully. So impact on patient outcomes. What is the quality of the product? Is it a good product? If you have a product that's already in your facility, are you going to be replacing this new product with that? So you need to look at the quality of the particular product. Does this address the greatest threat of real harm to your patient, to my patient? Are there potential unintended side effects or complications from using this particular product? So what you really need to pay close attention to is there an FDA-approved indication in there? You need to look into any recalls and FDA citations. Is the vendor that is recommending this product to you part of your GPO? So some hospitals are a part of a GPO, which requires them to purchase specific products. So please ensure that your product has an FDA-approved indication. This all should be done ahead of time. There should be a little link in there that you can take a look at. Please ensure that there are no recalls and FDA citations. That's extremely important. So what's the impact on your facility and staff? What are the legal, safety, and quality implications on this? If the product is not used according to the manufacturer's instruction for use, or MIFU, we typically just say IFU, the device warranty may be null and void. And what I mean by that is if you use a particular product and you do not use the IFU in that particular product, and you use something on there to clean the device that is not actually a part of the IFU, that will null and void your warranty. You must always look at the IFU to ensure that you're using the appropriate cleaning disinfectant product on it. What is the greatest priority for my staff? What's the ease of use and there's no risk to the staff? Really ensure that the staff find the product easy to use and there's no side effects for the staff. How is it better than what we're using today? What makes this particular product better than what you're already using? Is it the contact time? Is it the smell? Is it the fact that it actually kills more organisms? How is it better than what you're using? That's a big, big thing that you need to look at, and I've repeated that twice. What other hospitals within your community is using this particular product? Are there other hospitals that are using the product and they have stopped using it? You always want to contact them personally to find out why they either have stopped using it and what were the reasons behind that, or if they continue to use it, why are they continuing to use it? These are really important steps to take because do not take the word of your manufacturer or your vendor. You need to check these particular things out for yourself. It's extremely important to do that. What are the educational needs for your staff? So how involved should that education be? Will your educational team have to create some type of education for the staff to use this? Or will the actual manufacturer or vendor have the education already completed for your staff? They'll come in and do the initial training. They'll train the trainer. They'll come in after the product has been used to see how things are going and provide any additional training. So always make sure that you're taking a look at how important the training is and how much that's going to take. So when you're weighing the evidence for looking at a particular product or device, take a look at this. There are levels of evidence, and I've provided a link for you to go to the levels of evidence, evidence-based practice toolkit. It's a research hub at Winona State University, and I accessed that in March 2022. But you always want to search top to the bottom, and you're going to look at the evidence-based practice guides. You're going to look at either doing a meta-analysis, a systematic review, and there are different types of trials that you can take according to what the product is. So this is a lot of information here, but take the time to go through this and click on the link and look at the different types of levels of evidence. Levels of evidence to trialing products or devices. So there are 7 levels of evidence. The levels of evidence should be decided and based on how the product or device will affect patient care. Not all levels will be level 1. If level 1 does not work, then move on down to the next level. So you always want to just make sure that you're using the correct level. Remember, level 1 is the highest level of evidence from a systematic review. So if you're proceeding to a clinical trial, the definition of a clinical trial is according to the National Institute of Health, NIH. The goal of a clinical trial is to determine if these treatments that you're going to provide to patients, is it a prevention? Is it behavioral approaches? And are these all safe and effective? What are the outcomes that you are looking for? So participants may receive a product to use to intervene, such as a drug for high blood pressure. What you're looking at is, did patients receive a placebo other than the real drug? The results will be reviewed by the investigator. Did the blood pressure go down because of the high blood pressure medication that was provided? You're going to need to decide what type of trial you're going to use. And then you're going to develop a trial tool. What you're hoping for is that that manufacturer already has that tool provided for you. So if they have an evaluation tool already provided, we're going to look at the pros and cons. That's what you want to ensure, that you have something in there with pros and cons. In the evaluation, the things that you're going to look at is, you're going to measure the thing that is making you think about using this particular product. Another thing that you're going to take a look at, which is very important, is in that evaluation, what are the patient benefits? What are the employee benefits? Those are 2 really big things that you need to look at in that evaluation. Who's going to be involved in the trial? Or who's the end user? Is it going to be on the clinical side, nursing side, who are going to be using it? Or is it going to be on the non-clinical side for the end user? Outside of your department, if it's going to be nursing, you want to get an approval from nursing prior to trialing the product. You need to let them know in advance that you're looking at a particular product and that you're also wanting them to be a part of the trial. If you just go in there and say, we have a trial, we want you to use this, you might get pushback. So always involve your end users prior to agreeing to a trial. So there are countermeasures. Countermeasures are products that may be used to treat, prevent, or diagnose conditions that are associated with emerging infectious diseases or chemical, biological, radiological, or nuclear agents. That is CBRN. I've also provided a link within this document that you can go and take a look at what all countermeasures are. Countermeasures can actually be problematic, especially if they are occurring during a facility outbreak. So always remember, more than one countermeasure can be used at one time. So I'm going to give you an example. You may have had an issue, possibly an issue in your hospital with C. difficile. You're using bleach, some type of UV or other device or product, and you're adding additional hand washing stations within your facility. So you've got 3 different types of things that you're doing. Once your trial is over, you're going to look at what happened after the trial is over. The first thing you want to look at is, did your rates drop? If the rates dropped after you've used all of these 3 different recommended countermeasures, did they go back up after you completed your trial? So the concern and issue with using countermeasures is you may not know exactly which one of those countermeasures worked. So you could stop them one at a time and then see how your rates go. And that may help you to understand which one of those countermeasures actually worked. Well, in actuality, they all work together in conjunction. So it could be that you're using multiple different types of countermeasures that help you. You just need to know exactly which one, or is it all together that have helped? And what's your staff involvement? Always please remember, at the end of any trial that you're doing, you want to go back to your staff and you want to find out from them, what did they think? Did they fill out the survey that you're providing to them about the pros and cons of this particular type of product or device? Was there any smells? Were there any reactions? And then also let them know what the results are from the trial. Did rates go down? Was this particular device that was used on a patient something that helped maybe your C. diff rates go down or your cardioclapsy rates? These are important things to look at. Always involve your staff. Always go back to your staff to discuss with them what happened with the trial, what their thoughts were, and what the end results of the trials were. So with product training, attempt to use the device or product with no training, but not on a patient. Please do not ever do this on a live patient prior to your education or training. It can have some really bad results for you, and we do not want that. So when the vendor teaches you how to use it, how much time did it take? How intense was it? Did you use it correctly? Would all training need to be one-on-one, or would it need to be a group training? So if it's a one-on-one training, then that could be that you have a super user or you have a train the trainer. So there may be a super user who will always train someone else on different units or different departments to be a trainer. That way that the vendor or manufacturer does not have to continually come in to do training. They have a super user within the facility who can do train the trainer. Is it worth it? This is something that is extremely important for you to take a look at. There's always a cost for switching out products, whether it is on the front end or back end. If you work in this system with many sites, will this change or benefit all? And the reason why I'm asking that question is every single hospital is different. Every hospital has different demographics or patient population. They may not have the same issue that you have in one of your other facilities. So you need to narrow it down and find out, are you all having problems with the same particular issue? If it's site specific, then you'll use it only for your particular site. Was a value analysis done prior to? Now, when I say a value analysis, infection prevention works in conjunction with supply chain to review products, to get the opinions of the IPs, and then the IPs can also become part of the train the trainers for particular products or devices. Not all sites allow this, but some do. Now, with new products, there may need to be other products to support this. And by example, there's several different examples for that. There are also particular products that or devices that cannot be used with other wipes. So again, I stress to you the importance of looking at the instructions for use, the IFU, to see whether or not a particular product, say an Alaris pump, I'm using that as an example. You cannot use all disinfectant wipes with an Alaris pump. So you need to ensure that when you're doing your value analysis, that you have the right disinfectant if it's going to be a particular device, which these are extremely important things that you need to take a look at, whether it was worth it. Take this information back to your senior leadership. In summary, when evaluating products, always ensure the following. Ask for evidence-based unbiased reviews. Talk to other systems, other infection preventionists. They will provide you with the best unbiased reviews on products or devices. Ensure that the product will improve patient outcomes, improve in hospital-acquired infections. Ensure that proper education has occurred prior to the start of the trial by the end user. If education is ongoing, ensure either the vendor provides ongoing education or educates a super user. These are additional resources. And this is my contact information. Thank you very much.
To earn your contact hour of nursing continuing education associated with this session, you will need to take and pass the 10-question true-false test with a grade of 90% or better. To get started, click on or copy and paste the URL into your internet browser to be taken to our CE portal. You will be asked to register, and then you will be directed to the test. If you pass, you will be able to view, download, and save your certificate. If you do not pass, you will have a total of 5 attempts to retake the test. You may store and share your grades and certificates for all sessions in the portal and access them by using the unique links provided at the end of each presentation. If you have any questions, please email me at kelly@healthcarehygienemagazine.com. We're now opening up our Q&A session. With us right now is Lisa Kilgore. And as we wait for our attendees to send along their questions, why don't we dive in and talk about whether it's required to have a product selection or an evaluation committee at your facility. I'm wondering, who should be involved, and do you think that there should be specific training to be a part of this committee?
Thank you for the question. All products that are used within a facility should be evaluated by a multidisciplinary committee or team that comes from within the facility or within that system. It is also very important that the team lead or the facilitator is familiar with the 3 levels of complexity. Level 1, that's a minimal conversion, which is no trial that's necessary, such as you're renewing the contract for your laundry or linen. That's considered as value-based. For level 2, value-based and evidence-based, which is a limited trial for a short time, that means that you're really standardizing the products or devices, and it would be also with the value-based, which you would be using above. For level 3, that's all based on regulatory or patient safety concerns, and this involves multiple stakeholders such as physicians, nursing, EVS, food services. It depends on who the end user is, but that is also the most costly of the levels. So the following positions at minimum should be considered. So you're obviously going to have a team leader, a chairperson, that's your facilitator. You need to have someone from administration. So that's a secretary or an executive assistant who will be taking the notes to keep track of things. You always want to have a physician lead, also someone from nursing, someone from lab, radiology. It's always the end users that should always be involved in this. Someone from supply chain, biomed who possibly will be doing the PMs. And you want to have a clinical educator that's going to either educate the nurses, the physicians, or housekeeping, or EVS, or whoever it would be the end user.
Very good. We have our first question from an attendee. Should infection preventionists always be a part of the product selection and evaluation committee? And if so, what's the reasoning for that?
Well, that's a really good question. So IPs, infection preventionists, are an essential part of the product evaluation team, and they actually must participate in product selection in order to ensure that all products are selected using evidence-based data and the regulatory guidelines. So the Joint Commission requires that all healthcare facilities have goals that prevent the spread and transmission of infections that are associated with any types of medical devices, medical equipment, and any supplies that keep the facility's environment clean from bacteria and infections.
Great, thanks. Our next question, should a process or workflow be developed by this committee in order to standardize how products are reviewed?
Well, actually, yes, the following should be considered. So I have a list of things that I have thought up in my head, and I've actually done a lot of research on this. So the need for a product is identified. That's the very first thing. Is it new, or are you replacing an existing product that you may be having an issue with? Once you're doing that, you're going to look at the products that are selected for review. You're going to look at any literature for other clinical trials. You're going to look at the cost analysis, because if the product is so expensive, it doesn't really make sense to replace it. You should stick with the existing product that you're using. And is this also a product that is used at any other facilities? Of course, again, you must have infection prevention involvement for review of any possible safety or infection control issues. You want to also develop a trial. You want to conduct that trial. And then you want to evaluate all of the results from the end users. Then you want to present those results back to your committee. And once the committee approves this trial, then you're going to develop education, and hopefully the vendor already has education completed. And then you're going to have competencies in order to ensure that the product is used effectively and safely.
Here's an interesting question. What is recommended and or required to be considered as sufficient training to be a super user or a train the trainer? Are they required to be certified? And if so, how often, if at all, do you need to recertify?
Well, it's really important to provide appropriate training to either the end user and or the super users to prevent possible adverse patient outcomes. Patients and staff always come first, no matter what. So we always want to ensure that there is appropriate training before any type of product that is used on a patient, or any product that is used to clean the environment, because it could destroy your property, which would make that null and void. Typically, if you have a train the trainer or the super user, there's going to be ongoing training constantly. And it's really important to ensure that there's no user errors that occur during this time frame. And if it does, that's because of a lack of knowledge or experience. So ongoing training is extremely important. If it's been some time, have the vendor come back out and do some additional training. There is a lot of turnover in healthcare now, so it's truly important to ensure that there is proper education on all products that are used.
Terrific. Thank you for those insights. Our next question is, what do you recommend that should be done in order to have a more efficient rollout for either a new product or a device?
So what I've found is that stakeholder involvement through the entire process is vital. If you have a recommended product and you don't involve those end users in every step of the way, it's not going to be a successful rollout of that particular product or device. Another important thing is to have your C-suite buy-in or oversight of this, because if you're working to roll out some new process or a new device or some new type of product, but your C-suite is not involved in this, it's going to go nowhere. This is going to delay in the decision. So always involve your senior leaders, or someone from your C-suite team actually should be a part of that committee, the multidisciplinary committee, somewhere along the line, or maybe they could designate someone to make decisions for them. But what's important is C-suite can also ensure that there is a physician representative, especially if the physician is the end user. So it's extremely important to have all of your stakeholders involved in the process from the very beginning all the way till the end.
Excellent.
Thank you for having me. Have a wonderful day.
Well, thank you. We have reached the end of our Q&A session today. If you have any additional questions, please send them to me at kelly@healthcarehygienemagazine.com. We'll get them to our presenter and include them in a transcript of this Q&A that will be available for download shortly. As we wrap up this symposium, we do invite you to stay tuned for more details on future symposium, and we thank you so much for your participation. Our symposium on healthcare value analysis and infection prevention has now concluded. We invite you to return to the event platform from now until August 5th to access any of the sessions, take the CE tests, and download resources from the virtual expo hall. We also acknowledge our partners, AVAP, the Pierce Foundation for Scientific Endeavor, and ESOP, as well as our event underwriter, Cintas Corporation, for making this event a success. Thanks for your participation, and we'll see you at our next symposium.